celebrate the victory of light over darkness, let's also prioritize the safety of our loved ones. Diwali is a time for family and friends. Let's ensure everyone returns home safely. A moment of negligence can lead to lifelong regret. Let's take eye safety seriously. Traditionally, the Festival of Lights was celebrated in a very sustainable and safe manner. However, with the advent of firecrackers and their widespread usage, an added dimension to safety of individuals against firecracker injuries has been witnessed. Our aim is to spread awareness and ensure precautionary eye safety and remedial actions in case of eye injuries due to firecrackers. In this Samvad, we have with us Dr. Mannan V. Solanki, Consultant Ophthalmologist, Director, Shrinath Eye Hospital, MBBS, DO.MS, DNB Ophthalmology, and Professor Devanshi Dalal, Assistant Professor, Department of Optometry, Bapubhai, Desaibhai, Patel Institute of Paramedical Sciences, Faculty of Medicine, CHAROTAR University of Science and Technology, properly known as CHARUSAT, Gujarat. For the benefit of the audience, we shall request Dr. Mannan and Ms. Devanshi to give a brief introduction about themselves.
Yeah. Hello, this is Devanshi Dalal. So, I'm an optometrist working in the field of pediatric optometry and low vision, and I'm working as an assistant professor at the Department of Optometry, BDIPS, CHARUSAT. So I'm also involved in teaching as well as the clinical works and looking at those myopia related consequences going on. My PhD is also going on under the field of myopia control. Thank you for having us here.
Thank you so much. And Dr. Mannan?
Hello, everyone. Myself, Dr. Mannan Solanki. I'm an practicing ophthalmologist. And currently, I'm practicing at my private clinic, Shrinath Eye Hospital, Navan Aroda, Ahmedabad. And I'm in this same field since past 8 years. And I'm doing general ophthalmology and as well as trauma to the eye.
That's great. Thank you so much. Going down straight to the questions, Dr. Mannan, as we celebrate the Festival of Lights, many of us are unaware of the hidden dangers lurking in the shadows. Can you share with us the most common types of eye injuries that occur during Diwali due to firecrackers?
Actually, firecrackers is one of the for Diwali. It is as good for enjoying, and also it has to be taken as a precautionary measure. So firecrackers usually causes injury that is of different varieties, ranging from mild, means small, minor injuries to the severe extent. The most common types of that include corneal abrasions, conjunctival or corneal foreign bodies, chemical burns, blunt trauma, fume injuries, and the more severe injuries that includes the corneal lacerations and even the globe rupture of the total rupture of the eyeball through and through. In some cases, foreign body can penetrate the eye, leading to infection. Even it can reach up to the retina and stay there. And as a retinal foreign body, it will, and that may lead to permanent visual loss if not treated on time.
Right. So in case, we'll go further as an add-on question, which firecrackers pose the greatest threat to our vision and how can we identify them?
Yes, the firecrackers that explode with high force, like rockets, bombs, tend to be more dangerous. They can send shrapnel and debris flying in the air at high speed and stay in the eye or penetrate, which can easily cause sparkles, penetrating injuries, though seemingly it's harmless, but can also cause burns or emit sparkles that can damage the surface of the eye.
So, as an add-on question, what age groups are most vulnerable to these injuries and how can we ensure their safety?
The most common age group is children. So, we should take precautionary measure, especially the children should not allow alone to treat the firecrackers. They are often excited during the festive seasons and may not realize the danger that is involved in the firecracker. So their reaction may also be slower, which makes them more susceptible for the accident.
Okay, so now that we have understood the risks involved, I would ask Professor Devanshi. Diwali is a time for joy and celebration, but safety should also always come first. What simple precautions can we take to protect our eyes from harm?
Absolutely. So prevention is always better than cure, and specifically during the festival for joyous and safe celebrations, some simple measures should be considered. So the first and foremost is, of course, maintaining a safe distance. So when you are lighting the firecrackers, you maintain a safer distance. Maybe use a larger incense stick while burning them. Always wear your protective glasses, so avoid the accidental sparks. And when it comes to children, then they should always be supervised. They should be burning the crackers only under supervision of parents or the guardians, because most of the time injuries are reported in children only. And also keep the safety as a first aid ready, or maybe you can go for the safer alternatives for colorful rangolis or colorful lights.
So, as a follow-up question, what type of protective eyewear is essential for these, for those people who are around firecrackers, and where we can find them?
So for the protection and preventing the accidental sparks, your regular glasses might not be sufficient. And in that case, the polycarbonate safety glasses are considered to be the highest impact resistance. So even by the NZ standards, polycarbonate has been suggested. And we have to use a wraparound frame so that most of the part is covered, so that we can prevent the penetrating injuries from the flying objects. And these glasses, the safety glasses would be readily available at the nearest optical stores. So first of all, always consult your eye care practitioners and go ahead for your safety glasses. Or sometimes if in case, you might also go for your online products after consultation of your eye care practitioners.
So, continuing further, Devanshi, as a parent or a guardian, what advice would you give to ensure children's safety around firecrackers?
So as we discussed, that supervision is the first thing. They should not be left alone, because children are very inquisitive and they always want to burn the crackers by themselves. So the first is a strict supervision. Secondly, to ensure a safer distance, always burn the crackers into an open environment, and that to make sure that you are not going too near to the crackers. So maintain a safer distance by using a maybe a larger incense stick, or you should be facing the cracker such that your eyes are not very near to it. Most of the time we have like observed that children try to imitate their elder siblings, or maybe the people whom they are observing. So you yourself also make sure that you are not burning the cracker in your hand and then throwing out. Please avoid all such things, because children will immediately try to replicate such things and might end up in burning the cracker in the hand itself, causing a lot of serious injuries. And lastly, if at all by any chances, if eye injury occurs, then please, as a parent, do not try to manage it with the home remedies. Please rush to the nearest ophthalmologist and get the child managed.
That's a great advice, actually. And Dr. Mannan, as an ophthalmologist, in your experience, how effective are protective measures like, the protective eyewear or goggles, and what common mistakes do people make when trying to safeguard their eyes?
Protective goggles actually are very effective when it is worn correctly. They can prevent serious injuries by shielding the eyes from flying debris, sparks, and intense light. However, a common mistake people make is underestimating the distance they need to maintain from fireworks. So actually, we have to make it distance, and we have to we can make our head away from the crackers, and we just put our head towards the firecrackers. So even with the goggles, it is important to stay a safe distance, and especially goggles should be like fully cover eye, like protective goggles only, not the routine sunglass or like that. So it's important to stay a safe distance away from it. And also people sometimes lift their goggles during use, which actually have no use if we lift the goggles, which defect the purpose of wearing them. So the main thing is protective goggles. And the one more thing I'll add to this is, actually there are some devices available in market which usually marketed as a gas lighter, which we use at our home, LPG gas. So that device has a burning lighting at the end. So it is around 30 centimeter long. So we can use, instead of a fire stick, we can use that lighter. It is actually very helpful. I personally recommend that.
Okay. So, since we have now covered, prevention and safety tips, now, what would be an immediate response to eye injury? For example, accidents can still happen despite precautions. And Dr. Mannan, what should we do immediately if someone suffers an eye injury from a firecracker?
If an eye injury occurs due to firecrackers, the first thing is to stay calm, avoid touching or rubbing the eyes, and if the debris enter the eyes, try rinsing it with clean water or at least a tap water. But don't attempt to remove it by any object. So cover the injured eye and clean both the shield and or paper cup and stick. So cover the eye with a shield or a paper cup, which we usually get in our home. So, and take the medical help immediately. Rush to an ophthalmologist or at least an optometrist or at least general practitioner, whichever is nearby. So avoid using over-the-counter drops, especially which is given by a medical store. So until a professional help we can get, so don't use these over-counter drops and rush to an ophthalmologist as early as possible.
Right. So now, adding further, how can we distinguish between minor and severe injuries, and when should we seek medical attention?
That's a very important question, especially during Diwali when firecrackers related injury happen. Minor injury usually involves symptoms like slight redness, irritation, foreign body sensation, or something gritty sensation in the eye. This can often be soothed by gently rinsing the eye with clean water and avoiding any kind of rubbing. However, severe injuries are marked by symptoms like intense pain, sudden change in the vision, or blood in the eye, or visible wound on the surface of the eye, or if someone experiences this type of signs, essentially they should seek an immediate medical attention, and prompt care from an ophthalmologist can prevent this complication and help to save a vision. Remember, when in doubt, it's always safer to consult a professional.
Yeah, so when we talk about doubt, actually most of the people, when they're minor injuries, they say that, this is gone, I am not feeling anything. And, what are the long-term consequences of untreated eye injuries? That's the question. And why is it that, prompt medical care is crucial?
The untreated eye injuries can have serious and sometimes permanent consequences. For instance, even a small scratch or foreign object in the eye, if ignored, can lead to infections like corneal ulcers. This can result in scarring that can permanently impair the vision. Severe injuries such as blunt trauma or burns can cause internal bleeding, retinal damage, or even retinal detachment, all of which can lead to vision loss if left untreated. Prompt medical care is crucial because early intervention can prevent these complications. An ophthalmologist, as an ophthalmologist, can access these injuries accurately and provide its treatment, whether medication or surgery, to protect or to restore the vision. The quicker we address to an eye injury, the higher chances of full recovery and preserving the eye health for the future.
So now, since we have now covered, the immediate response to eye injury, now we come to Professor Devanshi. As an optometrist, you have seen the devastating impact of firecracker-related eye injuries. How do you and your colleagues play a crucial role in treating and managing these traumatic cases?
Yeah, so as a low vision practitioner, it is very disappointing to see such a serious consequence of the preventable injuries. So here comes the role. The first and the most important is in terms of spreading the awareness, educating for the preventing measures and safety tips. The next comes is in terms of the referral for the vision rehabilitation. So whenever the untreatable or the cases where the vision is not very good, so at that time of providing the vital support to the individuals for adjusting to their daily life in terms of enhancing their quality of life, the low vision and rehabilitation comes as a vital role in case of the traumatic injuries.
That's great. So now, Dr. Mannan, as Devanshi said, for those who have suffered severe eye injuries, what's the road to recovery like? And how can an ophthalmologist provide vital support and care?
Recovering from severe eye injuries can be a challenging and multifaceted process. The road to recovery typically involves several different stages, including the immediate medical intervention, rehabilitation, and ongoing support. Here is an overview of the recovery process. So how can an ophthalmologist play a vital role? So the immediate medical care first. So emergency treatment, the first step is often an emergency care to access and stabilize the injury. This may include surgery to repair the damage, manage bleeding, prevent infection, and even the removal of the foreign body which is embedded in the eye. And so that is the emergency treatment. Then a diagnosis and assessment, detailed imaging like CT scan, MRI, or B scan, that is ultrasound for the eye, can be conducted to understand the extent of the injury. So even if in some cases we see that the injured, the debris wouldn't be appear over the eye, it may already penetrate the eye and embedded over the retina. That can be diagnosed by only ultrasound. So the other phase is first is emergency, immediate medical care, and then the rehabilitation phase. So in rehabilitation phase, the most precious thing is vision. So vision rehabilitation. Once the eye injuries got stabilized, patient may begin begin our vision rehabilitation. This can include the vision therapy to address the issues like a double vision, loss of visual field, or difficulty with coordination. Use of assistive device. The patient may benefit from the low vision aids or the other assistive technology to maximize the remaining vision. Ongoing care and support. The third thing, the regular follow-up appointments, continuous monitoring is essential as to access the healing and detect any complication which may occur, so we can detect it early. Then the psychological support, which we require in each and every patient, coping with the emotional and psychological impact of vision loss is very crucial, referring patients to the counselor or support groups that can be beneficial. And a role of optometrist, especially like our expert Devanshi. So any of the optometrists, their role is in comprehensive eye examination. So, and then vision therapy, patient education, and coordination of the eye care. So they have to first they can perform the eye examination, they monitor healing, adjust the treatment plan necessary. Then vision therapy, they provide the specialized vision therapy to regain the visual function. Then their patient education, they can educate the patient, other treatment options, self-care strategies, then guidance and guidance for the eye protection and managing the symptoms, and coordination with the ophthalmologist, physical therapist, and the other healthcare professionals to approach for the patient's recovery. And the last one is low vision service. If the patient has remained permanent damage and got the low vision for the lifetime, then we can do low vision aids. We can give them low vision aids so they can enhance their quality of life. Functional vision, at least they can get from that. Then the challenges, challenges we got in the recovery. The patient may face the physical, emotional, and social challenges during recovery. So addressing these needs holistically is essential for the successful rehabilitation. So overall, the road to recovery from severe eye injury is highly individualized, and optometrists are crucial role in providing ongoing support, rehabilitation, education to help the patient navigate this journey by employing a patient-centered approach and collaborating with other healthcare professionals, especially ophthalmologists, can significantly improve its outcome and quality of life for those affected by severe eye injury.
Thank you so much for clarifying the role of eye care practitioners and the roles and responsibilities of each individual working in the field. Now, Dr. Mannan, as we celebrate the Festival of Lights, what's the one thing you wish everyone would remember to protect their precious vision from firecracker related harm?
Thank you. If there is one message I could share, it's this: always wear protective eyewear. A firecracker accidents can happen in microseconds, in a split of seconds, and protecting your eyes with goggles or even simple safety glasses can make all the difference. Eye injuries from firecrackers are often preventable, and safeguarding our eyes allows us to enjoy the Diwali without risking our precious vision.
Right. So, Professor Devanshi, what's your heartfelt message to those celebrating Diwali, and how can we ensure a joyous, injury-free festival season for all?
So, as we celebrate Diwali, and especially for the people in Gujarat, it is a new year. Basically, a day after the Diwali is celebrated as the new year in Gujarat. So, it is a wonderful time for Festival of Lights. And at that time, we wish everyone for health, wealth, and happiness in the coming years. So, let's start with health as the greatest wealth, and we can find a way for foundation of the happiness if health is good. So, especially when it comes to children, use the safer alternatives. If at all burning the crackers, then always under the supervision of the parents or the guardians, and use your protective eyewears and keep a safe distance. Also, to prevent the accidents, you have to always have this do's and don'ts for the safety measures in your mind. So let us focus on the safety of everyone and enjoy the festival of bright light. Happy Diwali to all.
Happy Diwali to all.
Right. So this is, this is a wonderful session in terms of, understanding, what all precautions and safety measures one can take to safeguard the sparkle in a child's eye during this Diwali. A moment of negligence can snatch away a lifetime of vision. Let's prioritize eye safety. With this message, eye care practitioners are need to be celebrated because these are the guardians of our vision. Let's support their life-changing work this Diwali season. Thank you, Dr. Mannan and Professor Devanshi Dalal, for sharing these immensely beneficial prevention and remedial measures to ensure eye safety during the festival of Diwali. Thank you so much.
Thank you for having us here, and I hope this awareness helps the people a lot. Thank you.